So as Mats has told you, I'm a medical doctor. I'm also a licensed acupuncturist, and I help people in their personal lives and in their business lives to live more fully. And most of my work happens in workshops, on television, in books, internet programs, and for a few VIP clients, one-on-one or with their families. So today we're going to talk about how to build resilience after trauma. And we will specifically be looking at mindfulness, meditation, and positive psychology techniques. So all of you are, of course, very much aware that some people after trauma just crumble. It's as if everything just goes away in their life. And there are other people after trauma who seem to bounce back. They seem to create new meaning in their life, and they go on to thrive. And we're going to start to investigate what sort of differences are happening inside them, particularly in the brain, and how you can help your clients and your communities to build resilience. So our agenda today will be to look at neuroplasticity, which is the brain being plastic and how trauma changes the brain. We'll also look at the neurobiology of meditation and positive psychology. We'll have time for question and answer, and then I'll take you through an experiential exercise, something that I've created called the attunement meditation that is very helpful for people with trauma. We have some learning objectives, understanding the evidence of neuroplasticity and trauma, learning 9 resilience skills that you're going to want your clients to learn, and again, experiencing the attunement meditation. And just by a show of hands, how many of you are going to be with us tomorrow as well?
Most of the people.
Excellent. So anything we don't cover or any other questions you have, then we'll be able to get to them tomorrow. So how did I get into this intersection between the brain and tapping and all of that? Well, I started off going through medical school like everyone else in America. And my mother, who is also a physician, started treating women who were addicted to crack cocaine, who were either pregnant or they were immediately in the postpartum period. And this was, in the 90s when the crack cocaine epidemic was really high in America. And I had a conversation with her, and she told me that she was helping these women detox without any medication. And I thought, okay, that's just not possible. It's simply, it's impossible. How could that ever occur? And she said, with acupuncture. And so for any of you who have ever treated people who were addicted to substances, then you know that usually they're in the hospital or they're getting, support with fluids and medications so that they're not going through terrible withdrawals. But what she told me was with just these little tiny needles that she was placing around the ears, they were able to get off of cocaine. They were able to decrease craving. They were not having drug dreams. And they were going back to the court to get their children back, to start creating their life again. So I thought, what is it about acupuncture that can help people get off of drugs and change so drastically? How many of you have ever had acupuncture? Okay. So you know that these little tiny needles, it's not like a hypodermic needle. There's nothing in it. You don't inject medicine. There are these sterile needles that we place just under the skin. So I went home and visited my mother. This was in my 3rd year of medical school. And she put in the needles and she left me to sit in the room with the nice little music on. And suddenly I had this rush of energy. I could feel emotion bubbling up inside of me. And I literally had tears rolling down my face. And I thought, what is going on? How is this even possible? And that's what led me to go back to medical school talk to the dean of our medical school and convince him to let me go to New York and study with Dr. Michael Smith, who was one of the pioneers since the 70s of bringing acupuncture to America and testing it and using it for drug and alcohol detox. So it was at that moment that I realized there's much more going on between the mind and the body and the brain than what they were explaining to me in medical school. And so that's what really led me to investigate, well, how can we change brain chemistry by relaxation and these sorts of things? And so for the last 15 years in medical practice, I have blended Eastern medicine and Western medicine to help people overcome their challenges, whether that's addiction, whether it's eating disorders, whether it's after trauma, or just trying to, find themselves and then live a meaningful life. That's what led me into this. And about 10 years ago, I noticed that when people were in my clinic and we put in the acupuncture, their stress level would decrease. And of course, they were thinking, what can I do to do this at home? Can you come with me at home where my husband is getting on my nerves, or my kids, or at work? And that's when I discovered tapping. And I realized that the EFT and the TFT algorithms were tapping into these exact acupoints on the body that lowered stress, but also helped people to develop what I call sort of this objective view of their problems without all of the emotional turmoil. And 10 years ago, I started teaching my patients how to do it, so that if they were in the clinic, they'd get acupuncture, they'd get good teaching, they'd get therapy, and then they had a way to maintain that on the outside. Now, I wish there were more studies on the efficacy of TFT, but what I will share with you today is what we know so far and how you can start using that with some other meditation and positive psychology techniques. Sound good?
That sounds good.
Okay. So let's first just do a very brief review on neuroplasticity. This is this concept of you can actually change your mind and change your brain. So neuroplasticity is the lifelong ability of our brains to reorganize neural pathways. All of that is based on our experiences. So with neuroplasticity, we know that the brain can react and adapt in response to challenges and learning. The brain can alter its functional organization as a result of experience. It can be shaped, it can be molded. The brain can learn and remember, and the brain has the ability to reorganize and recover after injury. So it can reorganize in a organized way, or it can be restructured in a very disorganized way. And that's what happens with trauma. And that's what we'll talk about today. So there are types of neuroplasticity. There's neurogenesis, where new neurons are migrating into different areas. And then there's synaptogenesis. And this is the increase in those little synapses that fire between neurons. So you've probably heard of the Hebb rule. Neurons that fire together, wire together. And this is the concept that when our brain cells get activated together, then those synapses are strengthened and preserved. And the neurons and synapses that are activated repeatedly are preserved, while the other ones that are not used just start to prune and die away. So if we look at what happens to the brain in trauma, there's some very key areas that you want to know about. Now, of course, we always talk about the amygdala down here in red, because that's the part that is part of the old brain, or the primitive brain, or some people call it the reptilian brain, because we, like reptiles, we all have the same part of the lower brain, and it responds to emotional stress. Well, the other parts of the brain that are affected in trauma are the anterior cingulate cortex and the prefrontal cortex and the hippocampus. So these higher portions of the brain, the cortex, those are specific to human beings. So not reptiles and rats, but we humans have these higher brain centers that normally allow us to have executive function, meaning we can plan, we can choose what we're going to do. And the hippocampus is involved in memory. So if we look at some of these four key areas that are involved in trauma, we're looking at the hypothalamus, the pituitary, the amygdala, and the hippocampus. So you've heard of probably the HPA axis. So this axis is what balances us out when a stressful event happens. So the hypothalamus gets involved, sends a message to the pituitary, and that activates the adrenals. So how does that work? Well, the amygdala, that part of our primitive brain, which we typically think of as the fight, flight, or freeze response, the stress response. It's that old part of the brain that's always looking for a threat, what is going to kill us. It's always turned on and looking for what might threaten our survival. So when the amygdala detects some sort of a threat, it activates the hypothalamus. The hypothalamus will then kick in a hormone flood, these catecholamines that then go down to the adrenals. And adrenal sounds like adrenaline, right? So those are those adrenaline factors that kick in that give us the strength to either fight the bear or flee from the bear. And as many of you know, especially with patients after significant trauma, they can also freeze. So most people are now renaming the stress response, instead of just fight or flight, it's fight, flight, or freeze. Now, when all of those hormones kick in, it can actually completely shut down the body. So what does that mean? That means our clients are left with utter confusion. Everything in the brain becomes dysregulated. Things are not moving as linearly and coherently as before. And that typically leads to our clients feeling lost, confused, completely disoriented. It's as if they've lost their ability to figure out which way is up and where they're going in life. And when you talk to people, what they say is they literally feel lost inside themselves. And that's what we want to start to help them reconnect with. So how can we do that? Well, many people have seen that helping people develop a positive mindset and a positive attitude comes when we start to feel calm and less stressed. But how do we do that when people are immediately traumatized? What we find is that for many people, they can't think positively because there's so much in the stress response that they just can't think. And that's one of the reasons why I find acupuncture and tapping therapy to be so helpful. Because by just doing these taps, we can help them to decouple that part of the brain that's always associating every little threat in the environment. So if we can help them create calm of that stress response by doing a tapping sequence, then the higher brain centers can come back because they can't think. Their higher brain centers are completely shut off, whether it's acute stress or they've been traumatized and they're reliving the stress on a day-to-day basis. So by tapping, we help people bring the lower brain into a more calm state so that they can activate these higher brain centers, which then you or a psychologist or other therapist or a life coach can then actually do the good work of helping them get past the trauma and into looking forward in the rest of their life. Does this make sense so far?
Yes. It's good.
We good? Okay, great. So let's move on to the next bit then. So how do we do that? Well, in my work, for the last 10 years, I've been working in positive psychology. this is the science of happiness and meaning. And I don't know if Matt's told you, I'm a bit of a nerd. I tend to like scientific studies. I like to know why things work. So I kind of prefer things that are evidence-based. And so I loved learning from Dr. Martin Seligman that positive psychology over the last 25, 30 years has really become a branch of science. So we're looking at positive emotions, engagement, positive relationships, meaning and accomplishment. So rather than focusing on what's wrong with people, positive psychology helps us start to look at positive emotions, strengths, and then helping those people to reclaim those strengths so that they can move forward with their lives. And that's what traumatized people need. They need to reconnect to what's good in them. The other piece of what really helps people after trauma is meditation. So how many of you in the room currently have a meditation practice? Any of you meditate regularly? Okay. So meditation has been studied for, good 20 plus years now, almost 35 maybe. We know that scientifically, using really good studies, that meditation can help reduce pain. It enhances the body's immune system so that we can bounce back after infection or illness. Meditation reduces the feelings of depression, anxiety, confusion. It improves blood flow. It slows down the heart rate, gives us a sense of peace and calm and balance. It can even help reverse heart disease, which I think is extraordinary when you look at studies that actually show it can clean up your blood vessels. It also helps us control our thoughts, increases energy, and reduces stress. So what is meditation? Well, the practice of meditation is choosing an object of attention, placing your attention on that object, and returning to it over and over again. So when people come to me and they say, oh, I've never meditated before, I say, are you really sure? Because all meditation is choosing an object of attention and placing your attention on it and coming back to it. So, for example, if you started dating someone new and all day you just keep thinking about that person, and every song that comes on the radio makes you think of that person, and then you're at work and you just can't stop thinking about that person, well, that's meditation. And the same goes for if you're angry. If someone has really hurt you or done something terrible to you, and you call up your best girlfriend and you're like telling them about this terrible thing, and then at work you just can't stop thinking about it, and you're thinking about revenge, and you're thinking about how wrong it was, that's meditation. When you put your attention on something and return to it over and over, it's meditation. So I tell you this just because sometimes our clients feel like, oh, meditation, that means I have to sit in some pose and go off in the mountains. No, it's just about bringing your attention onto an object. And that object could be a number of things, which we'll get into. So what about mindfulness? A lot of people are hearing about mindfulness. And I think the reason that it's taking such a high position in written blogs and magazines is because then it doesn't get tied to a religion. It's not tied to spirituality. But mindfulness is just the intentional, non-judgmental awareness and acceptance of experiences in the present moment. So that just means putting your attention on something that's happening right now, not in the past, not in the future, but what's happening right now, whether it's in your body or it's in your mind or it's in your life. And that's what mindfulness is about. It's about becoming non-judgmental and accepting it. Because many of our clients don't want to be present to pain or negative emotions because they start to judge themselves. They start to feel like, oh, it's bad. I'm wrong for thinking this way. I shouldn't be doing this. But mindfulness helps our clients just be present with what's going on without judging it. So if we talk about the different types of meditation, there's concentration meditation. And again, this just means you're focusing on a thought, which could be a prayer. It could be an internal image. Some people like to imagine a peaceful scene. It could be a mantra. a repeated word or a sound. It could be specific body sensations. Many people begin their meditation practice by just focusing on their breath and what it feels like. You could also focus on emotions, such as joy or compassion. So there have been a number of studies, and the most scientific studies have been done on breath awareness, body scanning, where clients are asked to just sit and imagine, that they're relaxing their scalp and then their face and then all the way down the body, and that causes progressive relaxation. Transcendental meditation, which involves a mantra and is a practice where someone is instructed. They go through formal instruction to receive their mantra. And then the loving kindness, or the Metta meditation, which is all about sending unconditional compassion to oneself and then to others. So the interesting thing about this Metta meditation, specifically as it pertains to our traumatized clients, is there have been a number of studies that show that it actually impacts the brain. So those same parts of the brain that get damaged with trauma can be reprogrammed with these types of meditation. So the loving kindness or Metta meditation is where we ask ourselves and our clients to generate the feeling and then express the wish for the well-being of oneself and others. So the way that typically starts off is we first direct it to ourselves. And again, this is helping our clients develop self-compassion, which you can imagine if someone has witnessed a trauma, they've witnessed someone be brutally murdered, sometimes they feel guilty because they're still alive. Or maybe they have had something terrible happen to them and they feel ashamed or guilty as if they brought it on themselves. So by doing this loving kindness meditation, we're helping people to reconnect with self-compassion. So once a person is in a calm state, and again, you may have to do a few rounds of tapping just to bring them into a calm state of being, then they simply say, may I be happy. May I be well. May I be safe. May I be peaceful and at ease. And the more that they're able to actually start imagining themselves feeling that way, then they can start to change the circuits in their brain that get messed up. And then we next direct our wishes toward other people. Generally, we start with the people close to us, the people that are easy to love. So, you start after yourself, you start with your loved ones or the family members that you care about. And then eventually you get to people who are neutral, that you don't love or hate. Maybe it's the mailman or the person that delivers, your packages at the office. Then you start to wish them this loving kindness. And eventually you wish even your enemies or the person who may have perpetrated some trauma toward you. Eventually, little by little, with practice, people are able to do exactly that. So we said that mindfulness is this non-judgmental awareness of experiences, and that's what we're helping people to accomplish. So we always have to ask our clients, is your mind full? Or are you starting to be mindful? Mindful means you're just directing your attention to one or two things, right here and right now, and getting rid of that monkey mind that is so full of confusion. Does this make sense so far?
Yes. Makes sense.
Okay. So we all know that, being relaxed is nice, but let's get into some more science. So what are the functional effects of mindfulness? Well, one is attention regulation. If you've seen someone who's traumatized, they feel like, and they often look like, they're just not there. It's like they can't focus, or they feel so overwhelmed that they're hyper vigilant. They're focused on every little potential threat. Mindfulness can help us develop attention regulation. It can also help with body awareness. And I'm sure Mats can tell you a lot more about how people become dissociated from their bodies, or how certain pain can just so overwhelm them that they can no longer tell you what hurts because they just feel like everything hurts. And emotion regulation. You know, a lot of people will either be completely numb or depressed, or sometimes they can just be, you know, kind of giddy or inappropriate laughter sometimes. And there's also a change in the perspective of the self. The more that people are able to engage in mindfulness and meditation, the more they're able to recognize, I am not my thoughts. These thoughts are coming, but they're not me. They're also able to realize, oh, I'm feeling emotion, or I feel pain in my body, but it's not me. Little by little, they're becoming the non-judgmental witness. It's a change in the perspective of the self. There's a bunch of studies here. I will email you this for any of you who really wants to know the science of how mindfulness and meditation have been studied, and how it's been shown to increase empathy, increase self-directedness and well-being, improving attention. There are a number of studies there. But I'm sorry?
That's okay.
Okay. So evidence shows that these mindfulness practices actually change the brain. So they can impact the anterior cingulate cortex, which is that part of the brain that was impacted in trauma, where people lose the ability to actively plan and figure out what they want to do next. The insula, the temporo-parietal junction, the frontolimbic network, and the default mode structures. All of these are impacted. So I wonder if you've ever heard of this guy. His name is Mathieu Ricard. He is a French monk who practices Tibetan Buddhism, and he has been named the happiest man in the world. Because when these researchers from the University of Wisconsin put all of these electrodes on his brain, he sat and he practiced the compassion meditation, which is that metta meditation that we just talked about. And they found that he had incredible activity in the left prefrontal cortex. The left prefrontal cortex is the part of our brain that's tied to happiness and positive well-being. He registered gamma waves off the chart. In fact, what has never been seen in the human studies before. So when he was interviewed after this, he said, the only thing I'm doing is meditating. Now, of course, he's been trained and he's been doing this for many, many years. But what it shows us is that we can change the brain. Now, Sarah Lazar from Harvard Medical School also did wonderful studies, and she showed that meditators, whether they were experienced meditators or people who just learned after 8 weeks of instruction, they had increased thickness of the cortex, and particularly the prefrontal cortex. These are those parts of the brain that get hit with trauma that can actually wither away. So meditation can really help our patients. The hippocampus. So remember, the hippocampus is, of course, involved in memory, but it interacts with the amygdala. Remember, the amygdala is what registers a threat. And then it generally sends a message to the hippocampus to say, okay, this is a scary situation, so remember this the next time we're in a situation like that. So what they discovered is that with meditation, you can improve the hippocampus, which gets destroyed for people who have long-standing trauma. The temporo-parietal junction. This is the part of the brain that helps us feel compassion and empathy for others. This is another area that in just 8 weeks showed increased thickness. Also, the amygdala, which is another part of the brain, that emotional center of the brain that really gets hit with stress and trauma. And we could lower the stress and lower the amygdala with just 8 weeks of treatment. So you can imagine that if you continue to do this, your clients are going to develop more empathy, more self-awareness, more attention control. Again, more studies for you here. I won't bore you now for us to go over any questions.
I have one question. How do you see, now we have talked about different methods that can be used together with tapping. And normally we will do the tapping to get them calmed down, and then it will be even more increased value with the other methods. We will later on today listen to a scientist and a psychiatrist who have been doing studies on TFT with very good results, together with myself some years ago. And he will also present more scientific studies on TFT, EFT around the world. And I'm personally 100% sure that we will get these kind of results that we see here when we are able to get somebody to try the tapping and to do the scientific studies. There are far too few compared to what we want to, but the future will be this, I think. What do you think about that?
I agree with you. I think there, certainly in America, there are more people that are becoming aware of TFT and EFT. And we are seeing very small studies, but they're being conducted, for example, looking at brain waves, because that's, again, something very easy. You just put on electrodes, you perform an EEG before tapping, during the diagnostic process, and after, and you can see that there are changes to brainwave. So I think the future will involve more people doing studies and hopefully with larger groups of people, so that we can start to see these same trends that we see with meditation that can help people understand that it may seem a little weird to be sitting here tapping on yourself, but you can literally change your brain. And when you can change the brain, then you're in a better position to change the rest of your life. So I'm excited to hear what comes out of the research and the findings that you have there. And I'm hopeful that in America we'll have more wide-scale studies conducted.
What we are doing here is when we can't do the scientific studies quick enough, we will get some more and more video material that actually shows the improvement. So because it's easy, observable, I think that's the second best thing to do.
Yeah.
Do you have any experiences that you remember now that you found very interesting using tapping?
What I never use it just by itself. So as you pointed out, it's always in combination. But I did get an email from the father of someone that I worked with in America just a few weeks ago. And I'd worked with his daughter years ago and, didn't really keep up with what was going on in her life. And he said, the thing that made the biggest difference was once we could do the tapping to kind of bring her to the present moment, because the abuse that she suffered just was so painful for her to think about that she would just leave. She would dissociate. And by doing the tapping, she could be more present because all of that stress was done. And then what was most useful for her was journaling. She didn't want to talk to people about the trauma, but as you know, you do need to get it out. So she started to journal. She started writing. And, he expressed to me that now, a few years later, he says she wants to publish a book. She actually wants to share her process and her story to help other young people who've been abused. And for me, that's just remarkable, because this is someone who was about to drop out of school. She was starting to misbehave and act out and get into trouble. And just by helping her to bring some calm, because of course they wanted to put her on medications, she refused. She didn't want to see any of the psychologists that were part of the court system. So she was really feeling, the parents were really feeling trapped. And this was a way for her to gain some control and mastery. So that's one story I can share that most recently has been very impressive to me.
I feel that probably tapping can do most of the things that other relaxation techniques good, effective relaxation techniques can do. And I see a lot of things that might be the same with acupuncture and tapping. You have some very special skills, I would say, in acupuncture when it comes to diabetes. Is that something you would say anything about now, or would you like it to wait to another time?
Well, yeah, certainly in primary care illnesses like heart disease and diabetes, from the very moment that I left medical school, I knew that we needed to bring both of them together. Because if you look at diabetes or heart disease and Alzheimer's disease, there's a inflammatory component. There's a stress component. So if we can help our clients lower their stress level and feel more in control, then that means when we put them on a program, whether it's to eat better or to think better or to exercise more or to quit smoking, they're going to have a greater sense of control. So with diabetes, for me, I think the biggest thing that adding in acupuncture and then teaching people to tap when they went home was just giving them a tool that could lower the stress hormones instantly. And when you get rid of inflammation, a lot of times you get rid of cravings. Because when we're stressed and we're feeling like we're just in hyperdrive, that's when we get these weird cravings and we just want to eat anything that we can get our hands on. So by giving people a sense of being able to do tapping and create calm in the body and brain, then they can go within and they can engage the higher brain centers and say, do I really need to eat this? You know, what am I trying to fix? Am I trying to calm myself by eating this donut? Am I trying to avoid dealing with the situation? And that's what I think is really impressive about creating that sense of awareness and insight that allows people to make better decisions.
I totally agree. Anybody? Yeah, we have a question here.
Yeah. Do you hear me?
Yes.
I'm working with groups with mindfulness, and I see during the meditation the stress is increasing. And what do you think about using tapping before, during the mindfulness, or afterwards? What is your experience of that?
Well, I would be interested to know what kinds of clients these are, because if you're noticing that they get more anxious when they start to be mindful, I'd wonder, you know, what kind of clients are they? Are they people who are dealing with trauma, where again, just being more present to negative emotion can be really disconcerting? What do you mean?
Could we say that? Yeah.
Sorry.
That's okay. Do you have a follow-up?
Well, I wanted to, yeah, go ahead and follow up and then I'll answer your question.
It's people with different, somehow traumas, and somehow a lot of stress is different. Groups of 8 to 15 people. So it's a mixed, different group from different parts. So, yeah.
Yeah, then I would recommend for anyone who gets more agitated with mindfulness and meditation, do tapping first and deep breathing first. In our clinic, what we would do is we put in the acupuncture needles, everyone would sit for 30 minutes, and I would do deep breathing and a guided meditation. Because the first thing you want to do is put the brain in a calm state before you ask them to start tuning into emotion or tuning into their bodies. So I would recommend that you, for anyone who's agitated, do the tapping first to see if you can stop whatever association is going on in the brain that's making them get hyper aroused.
Thank you.
I think that's a very good way of seeing how we could implement tapping together with other methods, because the relaxation comes so quickly, and when you are relaxed, it's even more easy to get the most out of the meditation.
Mm-hmm.
Mm-hmm.
Yeah, so it's going to be key to also do deep breathing, Because again, most people when they're stressed, they do shallow breathing. They end up trapping carbon dioxide in the upper lobes of their lungs. So if you can do the deep breathing as you're doing that initial tapping, then you're going to get rid of the carbon dioxide and you're going to initiate the relaxation response in the brain, which will immediately calm down the lower brain centers. So tapping along with deep breathing would be the way I would start in those cases.
But I would love you to say something to Norwegian doctors, Norwegian health authorities, personnel, about how you see the perspectives of these kind of methods in the future.
Well, I think what we're seeing is there's an increased need for alternative and complementary therapies. And we know that our brain can react and adapt to certain therapies, whether it's acupuncture, whether it's tapping, whether it's visualization and meditation. And I would say to those Norwegian doctors and healthcare providers, just open your mind and be willing to consider it. And then let's do some studies. Let's show what Mats and I and the other TFT practitioners around the world already know, that these types of treatments are helping people recover from trauma. It's helping people build resilience so that they get their life back and they create a life of meaning and purpose. So it's not crazy. It's not woo-woo. There's real science behind it. And now is the time to embrace that.
Thank you very much, Andrea. And I'm looking forward to talk a lot more with you on our ATL meetings and, of course, the next year. So let's share some more experiences. And I hope you all here can give a big hand to Dr. Andrea Pennington for talking to us.
Well, it was a pleasure. So I wish you a wonderful rest of your day, and I'll see you tomorrow.
See you tomorrow.